Good morning and welcome to this meeting of Westberkshire's Pharmaceutical Needs Assessment Subcommittee. I'm the Councillor Alan McCrow and I'm chair of the subcommittee. The other members of the subcommittee present today are Charlotte Parvitt, who's interim consultant in public health, and Zoe Campbell, who's acting service director, communities and wellbeing. Gordon Oliver is the clerk for the meeting. The meeting is being live streamed via YouTube, so members of the public are able to follow proceedings. Please can I ask everyone participating in the meeting to make sure they switch their microphones on to speak directly into them, switch them off and finish speaking. And please turn your mobile phone off. No test of the fire alarm is planned, so if we hear the fire alarm, we must leave the building immediately via the emergency exit over there. The assembly point is a Dolphin car park. If the lockdown alarm sounds, we will remain seated and await instructions from officers. We will adjourn the meeting until such time as it's safe to proceed. Do members have any questions about the way we're carrying out the meeting today? Thank you. Move on then to item 1 on the agenda, which is apologies. Do we have any apologies, please?
Yes, Chairman, we've got apologies from Professor John Ashton, and Charlotte Parvitt is present as his substitute, and from April Pebbody, and Zoe Campbell is present as her substitute.
Thank you. Move on then to item 2, the minutes. Are there any issues, please, with the minutes of the last meeting? But can I have a proposal then to approve the minutes, please? Thank you. Zoe, seconder, please. Thank you. Well, perhaps better if you weren't here at the last meeting. Perhaps it'd be better if I second the chair. Thank you. Good. Those in favour, please show. Thank you. Anybody? Nobody. Everybody is in favour. So, thank you. So I'll sign the minutes. Thank you, ma'am. Move on then to item 3, declarations of interest. Are there any declarations of interest, please? There are none, thank you. And then move on to item 4, the unforeseen benefits applications for new pharmacies in Gaywood Drive shops in Newbury and Kingsland Centre in Thatcham. Could I invite Charlotte Parvitt to present the report, please?
Thank you, Chair. So as the report outlines, this is the details provided within it are for the applications for unforeseen benefits, as you've just suggested, for 2 new pharmacies, Gaywood Drives, Newbury and Kingsland Centre in Thatcham. This subcommittee is asked to agree written representation to be submitted to the Primary Care Support England in response to the above applications on behalf of the Health and Wellbeing Board, and also asked to delegate the final approval for the wording of the response to the Interim Director of Public Health in consultation with the Chairman. So to summarise, just for this subcommittee to bear in mind that the Health and Wellbeing Board has a duty to keep the pharmaceutical needs assessment under review in light of any changes of provision of pharmaceutical services within the district, and also that the Health and Wellbeing Board is a statutory consultee on any application for new pharmacies within the area, and has delegated that responsibility to this subcommittee. So the paper provides the background behind the pharmaceutical needs assessment for information. And these 2 applications are set out within the report. So the first one that we'll consider, the Gaywood Drive, the proposal is for a new pharmacy with opening hours across Monday through Friday, from 9 a.m. till 6:30 p.m. So we should note the evening opening hour, and also a Saturday from 10 a.m. to 1 p.m. It's also a proposal to offer enhanced services in addition to standard services, and they will include substance misuse, needle exchange, antiviral provision, palliative care, smoking cessation, community pharmacy consultation service, which has now been incorporated into the Pharmacy First service, flu vaccination, pharmacy contraception service, hypertension, new medicine service, and minor ailments. The second unforeseen benefits application at Kingsland Centre is proposed for the new pharmacy to open Monday through Friday, 9 a.m. to 5 p.m, so core hours, and then also an additional Saturday 9 till 5 and Sunday 10 till 4. So in terms of out of hours, there won't be evening offer there, but there is weekend offer for that pharmacy. And again, in addition to those essential services, advanced and enhanced services are included within the application, including new medicine service, pharmacy seasonal influenza vaccination, again, the community pharmacy consultation service, which is now the Pharmacy First, hypertension case finding, smoking cessation, home delivery, medication review, needle and syringe exchange, out of hours service, patient group direction, supervised administration, and emergency supply. So it's important to consider those enhanced service when we're considering the local population and their needs. We've undertaken within public health an analysis, and it just to note that we had received the second application previously on the 23rd of January at Kingsland Centre, but it's been the decision for that consultation process to start again and for these both to be considered given the proximity to each other at the same time. When we're considering permission and our thoughts on these applications, we need to consider the significant benefits that they may bring. And in doing so, think a little bit about whether or not there's reasonable choice of pharmacy for our local residents, how easy access is for those who live or work near the proposed pharmacies, the access routes, walking, bus routes, car access, etc. Accessibility for those who are disabled, elderly, have young children, and have particular needs and problems accessing local pharmacies, and if there would be any other negative effects. So for us as a committee to bear that in mind. We've had a look through and we know that there have been 4 pharmacies within the Newbury and Thatcham area that have closed since 2022. The Lloyd's Pharmacy in the Kingsland Centre, pharmacy in Sainsbury's and Hector Way in Newbury, the Superdrug Pharmacy in Northbrook in Newbury, and also the Boots in Pharmacy in Thatcham. They've all been closed since August 22. There are 2 current pharmacies in Thatcham and 5 pharmacies in Newbury. And however, the notification was also received on the 28th of April for a recent application in Newbury Town Centre, and that's been approved. So to bear that in mind too. So it is a balance between obviously improving access and services for our local population without unstabilising the market due to capacity outstripping demand and thus subsequently causing access issues elsewhere for us to bear in mind. And as such, we have reviewed from the pharmaceutical needs assessment, the ratio of pharmacies per 100,000 population. When that was undertaken, it was 1.3 in Berkshire compared to 2.2 in England. So we have a lower ratio per 10,000 people. And the pharmacy closures across the district that I've previously mentioned meant that that rate reduced to 1 per 10,000 population. If we approve both of these applications, the ratio would increase back to 1.2 per 10,000 population, but that's still below the 2.2 on offer as an England average. We do need to take that piece of information with caution. There is the caveat that this simplistic ratio doesn't take into account the location, catchment, and the number of items dispensed, i.e. how efficient that pharmacy is working. So it's a very crude measure, but it does give us some assurance that we are not overpopulating our local economy with pharmacies. So in terms of Gaywood Drive, we've looked at the position. It indicates that there's no pharmacy situated in the Clay Hill or Thatcham wards, and that recent closures have caused a gap. However, we do note that the Health and Wellbeing Board haven't considered the closures of those previous pharmacies in creating a gap in provision, and it wasn't sufficiently a gap produced to justify a review of the full pharmaceutical needs assessment. So we do have to take that claim that there is a significant gap with caution again. Since the needs assessment, no additional households would be outside a 1 mile or a 20-minute travel time to their nearest pharmacy. So again, for us to bear that in mind. And then we've considered the population profile of the local residents within the areas. We know within Newbury, the Clay Hill ward to the northeast of the town centre has relatively low levels of deprivation, and that's displayed in the graph that's contained within the report. And in addition, it has lower numbers of older people aged 65 years and older, but it does have higher numbers of very young individuals, young children aged 4 years and younger. And we consider this because we know that with increased deprivation, there's increased poor health and well-being, and therefore increased need for the pharmacies. And also our populations aged over 65 and under 4 also utilise our pharmacy services more. So in that Clay Hill area, we would expect largely for the demand for pharmaceutical services to be as per the average across the borough, possibly some more activity required for the slightly higher age profile of younger children. Gaywood Drive's also the closest pharmacy to some residents of Thatcham West Ward, and those living in a small proportion to the west of Pound Lane would also benefit. And so we've done a little analysis on that population residing there. Again, has low levels of deprivations with no residents within deciles 1 to 6. And similarly, shows that the numbers aged 65 and over are similar to the average across the rest of the West Berkshire. And again, the ward does have higher numbers of young children aged 4 and under. So again, those considerations remain. We've then considered journey time. Clay Hill residents have journeys up to 2 miles to access pharmacies in Newbury and Thatcham. And whilst 2 miles doesn't sound very far, actually that can take 44 minutes on foot and at least 26 minutes by bus. So access it's there, but it's not optimal. We've considered the fact that the proposed location is a typical suburban location. There's no public car park, and it would involve clients parking curbside and in the surrounding roads. So we do need to have a consideration of that in terms of the negative impact of road safety for local residents around that area. Pharmacies that remain open after 6, again, the pharmaceutical needs assessment hasn't identified gaps in out-of-hours provision. However, whilst that gap hasn't been declared, anecdotal evidence from the Health Scrutiny Committee, Health Watch and social media have suggested that individuals have experienced waiting times for within that area, particularly at the Boots in Northbrook Street. And the needs assessment doesn't also identify any gaps in provision. In summary, however, the proposed pharmacy would provide additional coverage to that Newbury area that is anecdotally reported as being underserved. So that's the summary of the first application for the Gaywood Drive pharmacy. I'll pause just in case there's any questions before we go to Kingsland.
Sorry, did you have any comments on that, Zoe?
Supportive of the application, as we've had foreclosures recently. Great to see more pharmacies coming on board, and particularly with the enhanced public health services, smoking cessation, hypertension case finding, substance misuse. Supportive. Yeah, that's happy. Thank you.
There's a couple of thoughts of mine. First of all, Gaywood Drive is fairly close to the community hospital, isn't it? I'm not sure if people go to the minor injuries unit, if they might be given prescriptions to fulfill, whether that would be helpful. The other thing is that there's quite a lot of housing being built in Shaw, which isn't, and this would be the closest pharmacy to that. So several hundred houses being built there, I think. So that I think would be helpful. Also, there's 90 houses being built in Lower Way, which they might find it easier to get to Gaywood Drive than perhaps into the centre of Thatcham. So, any other thoughts?
And I just think in terms of the national picture with community pharmacy, where we are seeing more closures with those pharmacy provisions within large stores, etc., that the addition of these two smaller units would build resilience for the pharmacy provision across West Berkshire. So yeah.
Thank you. Shall we move on then to the one in the Kingswood Centre, which we've commented on already. So I think we've probably not quite done it to death, but probably almost.
Yeah, indeed. So just a very brief review over that Kingsland Centre application. As mentioned, we have reviewed this in the past. Although the pharmacy would be in Thatcham Central Ward, which has low levels of deprivation, realistically, it'd be expected to be used by all Thatcham residents, including those living in Thatcham North East, where we do see some pockets of deprivation. So in terms of that need, likely to see an increased demand within that area. And in terms of the age profile, the Thatcham Central and Thatcham North East, very similar, with slightly high numbers, again, of school-aged children, but slightly lower numbers of aged over 65. So the age profile shouldn't see an excess in demand. The pharmacy would be the only one in Thatcham to open the 7 days a week. And as we've mentioned before, the needs assessment didn't identify a gap in out-of-hours provision. That said, additional Saturday and Sunday opening would only improve access for those residents. It's proposed that the location has a good level of accessibility in terms of walking, cycling, local bus routes, so it doesn't have the limitations that we've previously discussed for the Gaywood Drive. And it should be noted in terms of destabilising the local pharmacy economy. The applicant also owns one of the other two pharmacies in the town, and so it is an assumption, but we can be it's reasonable perhaps to expect that this would have taken the commercial decision. That they wouldn't have taken that commercial decision if sufficient demand to sustain an additional pharmacy wasn't there. So again, in summary, we know the pharmaceutical needs assessment doesn't identify a gap in provision. We know that the need may be slightly raised in terms of the younger profile and some pockets of deprivation. We know that the individual submitting the application already has a business in the area. And we know that overall that crude ratio is still much below the England average. So the application would only enhance coverage within the Thatcham area and provide additional resilience to the pharmacy provision.
Thank you. Do you have anything to add, Zoe?
Again, positive in terms of support available for residents and particularly with the 7-day opening. So supportive, thank you.
I think when we wrote in favour of this one before, one of the issues was that there were several sheltered living, sheltered housing developments within walking distance of Kingsland Centre. Some quite new actually, and I think that's something to bear in mind. Also, the local plan review, there's currently is proposing to put 1,500 homes in northeast Thatcham or northeast of Thatcham, which could be increased beyond that. So I think that might be worthwhile mentioning that one as well. Okay. So thank you. So the recommendation is that the subcommittee is asked to agree a written representative to be submitted to Primary Care Support England in response to these applications, and delegate final approval of the wording of the response to the Interim Director of Public Health in consultation with the chairman of the subcommittee. But I think what we're saying also is that we're recommending that these applications be supported. I think that's the main thing, isn't it? Okay. So could I have a proposal, please? Sorry, thank you. And would you like to second that, Charles? Thank you. Could I have please, all those in favour, please show. Thank you. So that's unanimous. Thank you. So thank you very much for attending, and thank you very much for coming down from Devon. And there being no other business, I'd like to close the meeting. Thank you.